Welcome to the latest edition of Obesity Updates, covering breakthroughs in the past 2 weeks. Brought to you by Lucid Quest. In China, Guangzhou Innogen reports first patient dosed in a Phase 3 obesity and overweight trial of Efsubaglutide alfa, with planned enrollment of approximately 800 participants in China, and with clear disclosure that success is not guaranteed. In Japan, Skye secured exclusive rights to Roche's CT-388, a dual GLP-1 and GIP agonist. Overseas, Phase 1 in adults with obesity used once-weekly subcutaneous dosing for 24 weeks and showed a placebo-adjusted mean weight change of minus 18.8%. P less than 0.001, with Phase 2 ongoing overseas in obesity with type 2 diabetes. Ascletis announced selection of ASC35, a once-monthly subcutaneously administered GLP-1R and GIPR dual peptide agonist for clinical development. Preclinical studies in non-human primates and diet-induced obese mice were presented, with engineering for a longer half-life and higher exposure compared with Tirzepatide in head-to-head preclinical testing. The company plans a US IND for obesity in the second quarter of 2026, positioning ASC35 as a monthly candidate with potential manufacturing scalability. A regional roundup highlights the Korea-China obesity race, including Ildong's early Phase 1 signal for oral GLP-1 candidate ID 110521156. The company disclosed up to 13.8% weight loss at 4 weeks, and an average of 9.9% at the 200 mg dose with once-daily oral dosing, noting that interpretation depends on study design and confounding control. Skye Bioscience reported Phase 2A results for Nimacimab, a peripheral CB1 inhibitor. As monotherapy, change was minus 1.52% versus plus 0.26%. With placebo, with the company noting the dose may have been suboptimal. In combination with Semaglutide 2.4 milligrams, weight change reached minus 13.2% at 26 weeks, about 2.95% greater than Wegovy alone, with no added gastrointestinal or neuropsychiatric adverse events reported. In Europe, the European Association for the Study of Obesity issued guidance published in Nature Medicine, recommending GLP-1 agonists such as Semaglutide and Tirzepatide as first-line options when substantial weight loss is required, while remaining non-binding across countries and allowing condition-specific preferences. In the United States, Pfizer announced a White House pricing agreement that includes a direct purchasing platform and parity pricing with other developed markets. The company states Americans would gain significant discounts across many products and notes additional US investments, while specific terms remain confidential. Finally, Bill Gates and the Pan American Health Organization are exploring ways to expand GLP-1 access in lower-income countries. Reporting referenced semaglutide patents that are expiring in some countries and WHO draft guidance, with consideration of low-cost copies and potential foundation-supported trials through the Pan American Health Organization mechanisms. Stay ahead in obesity research, like, share and subscribe for our updates. Visit lqventures.com or email us at info@lqventures.com for expert healthcare consulting. See you next time.